The rising cost of veterinary care. It's a hot topic in the news right now and one that is causing a lot of stress among pet owners across the nation. Many of whom are wondering, will I be able to afford my pet's next medical bill? Today we'll discuss all of the reasons, the good and the not so great ones, for why veterinary care is costing so much these days, and the impact this has on pet owners, animals, and the veterinarians and veterinary staff responsible for providing care. Hi, I'm Dr. Teresa Schumacher, and this is VETTED, where you'll find educational resources, inspirational stories, and science-backed information to help you navigate a healthier future for you, your pets, and the planet. According to the Bureau of Labor Statistics, the price of urban veterinary care rose by 7.9% from February 2023 to February 2024. This is more than 2.5 times higher than the average for all consumer items in that time period. What this means is that inflation alone cannot explain the rising cost of veterinary care. There are multiple factors contributing to this phenomenon, all of which we will break down in today's episode. Let's start with the good news. The quality of care that pets receive has dramatically improved in the last few decades, and we've reached a point where our pets are receiving care that is often on par with human medicine. Consider, for example, a relatively common scenario. A dog that is brought to an emergency and specialty care clinic after being hit by a car. This dog is immediately triaged and evaluated by a highly trained emergency veterinarian who, upon initial assessment, determines that this patient has multiple problems, including systemic shock, internal bleeding, chest contusions, traumatic brain injury, a broken leg, and a previously diagnosed heart murmur. Stabilization efforts for this patient may involve intravenous fluids, medications, wound care, and a blood transfusion. And diagnostics are likely to include X-ray, ultrasound, blood test, monitoring of vital parameters, perhaps even a CT scan or an MRI. The patient is struggling to breathe because of its lung injuries, so a board-certified critical care specialist sets up a complex system of oxygen support, provides expert guidance to the emergency team, and even prepares a plan for mechanical ventilation if needed. A neurologist is consulted to help provide a treatment plan for the traumatic brain injury. Because of the heart murmur noted on exam, a cardiologist is consulted to assess cardiac function and determine a safe intravenous fluid therapy protocol. Once the patient is stabilized, an orthopedic surgeon will repair the fractured leg. When all said and done, this patient has spent a week in the hospital, been evaluated by at least 5 different doctors, and received round-the-clock intensive care by highly trained veterinary technicians and nursing staff. This example illustrates just how complex and sophisticated veterinary medicine has become, and why some veterinary medical bills end up costing thousands of dollars. 10 to 20 years ago, the only option for a very sick or severely injured animal might have been humane euthanasia. But now, with the advanced medical equipment and knowledge available, more animals are receiving higher quality care than ever before. Now let's talk basic economics. While the quality of veterinary care has improved, the demand for good quality care has also increased. Let's consider the way pet owners now view their pets, compared to even a few decades ago. My grandmother loved her dog Poncho, but Poncho's status as a dog was clearly defined. Poncho was a mutt who lived in a little doghouse out back, was fed generic dog food, and when Poncho got sick, she was taken to the vet to be put to sleep. There was never a conversation between my grandmother and the vet about costly medical or surgical interventions. Poncho was a dog, and while she lived a good life, it was a dog's life. Fast forward to today, where our animal companions have become more than just pets. They are now integral parts of our families. Terms like four-legged children and pet parents are commonly thrown about to describe our relationship with domestic animals. And as our relationship has evolved, so has our overall view on veterinary care. In 2023, Americans spent approximately $38 billion on veterinary care and related services for their dogs and cats. This is up from $29 billion in 2019 for comparison. Pet owners have shown, through their willingness to commit to extensive veterinary diagnostics and treatments, that their pet's health is a valuable commodity. And what about the pets we are treating? Those adorable dogs and cats we cherish have been created through years of selective breeding and genetic bottlenecking. Scroll through photographs of dog and cat breeds from a century ago, compared to their current counterparts, and you can see firsthand the dramatic changes in their physical traits. Changes that have been purposefully selected for, but unfortunately have also led to a loss of genetic diversity and higher risk for problems, such as orthopedic and spinal malformations, respiratory issues, heart disease, and cancer. It's a good thing that pet owners are willing to spend more money on their pets, because those pets are requiring more care than ever before. You've heard of big pharma and big tech, but have you heard of big vet? As pets have risen in status and owners have shown that they are willing to pay for quality care, big money investors have noticed. According to a recent article in The Atlantic, between 2017 and 2023, private equity poured $51.6 billion into the veterinary sector, and another $9.3 billion in the first 4 months of 2024 alone. The veterinary field has become a low-risk, high-reward business investment, and whenever this happens, it will pique the interest of big investors and major corporations. Recently, there's been a massive buy-up of privately owned veterinary clinics by big corporations, many of which have had no prior involvement in the veterinary sector. In the past decade, the total number of corporate-owned vet practices has gone from about 8% of all clinics to a whopping 25 to 30%, and that percentage just keeps growing. As for specialty clinics, those larger hospitals that employ board-certified specialists and offer intensive medical and surgical care, the percentage is closer to 75. Probably the most well-known example is Mars Incorporated, the creator of Skittles and Snickers, who is the largest owner of standalone veterinary clinics in the United States, operating more than 2,000 hospitals under the names Banfield, VCA, and Blue Pearl. Another major player is JAB Holding Company, an investment firm that owns Panera Bread, Peet's Coffee, and Krispy Kreme donuts, and has more recently set their sights on veterinary medicine as the next big investment prospect. Since 2020, JAB has acquired all of National Veterinary Association's 1,000 plus hospitals, and they also own more than 15 pet insurance companies. Yes, you heard that correctly.
What just happened?
In 2023, JAB Holding Company created their own separately managed business called Ethos Veterinary Health that is responsible for all of their emergency and specialty clinics nationwide. They have continued to expand and buy up hospitals so quickly that in 2022, they even caught the attention of the Federal Trade Commission, who required that JAB Holding Company seek approval prior to purchasing any more clinics within 25 miles of one already owned in California or Texas for the next decade. So what happens when you have a high demand for a product and the attention of major profit-based corporations? Two things. The quality of care tends to go up because hospitals can offer better equipment and more treatment options, but the overall cost for these services goes up as well. And make no mistake, while these corporations can offer an outstanding level of medicine and life-saving treatments for your pet, their bottom line is and will always be profit. They live by the capitalist creed, using their profits to expand, buy even more hospitals, and, you got it, make more profit. If we want to get an idea of where this is all headed, we can just take a look at human healthcare. Research in human healthcare shows that when private equity takes over a hospital or practice, the cost of care and the number of expensive procedures goes up. But the difference right now is that in veterinary medicine, unlike human healthcare, there is no pushback from companies such as Medicare to provide any cap on prices or to offer alternative solutions for clients from lower income homes. Pet insurance is sometimes discussed as a great option to balance out the rising cost of vet care, but the truth is it isn't the perfect solution that some claim it to be. While pet insurance is gaining popularity, the vast majority of pets still remain uninsured, and insurance does not generally cover wellness and preventative care. And with the rising cost of vet care, it is possible that pet insurance may not even be a sustainable business model for the future. In July of this year, Nationwide Pet Insurance, the nation's biggest provider of pet insurance, announced that they will cancel coverage for approximately 100,000 animals across the country due to the escalating cost of veterinary care.
Blantis fears her insurance could be dropped after Nationwide announced it's canceling 100,000 pet policies state by state, citing inflation in the cost of veterinary care and other factors.
It will be interesting to see where this is all headed. If veterinary medicine continues to mimic its human counterpart, whether government steps in and puts any regulations in place, and if veterinary medicine continues to be available to the average pet owner or just an elite few. Another factor to consider is that as the demand for high-quality veterinary medicine rises, The actual number of qualified veterinarians and veterinary technicians available to get the job done is not keeping up. Many people are deterred from a career in veterinary medicine because of the high cost of tuition, and veterinary schools are not producing enough new graduates to cover the increasing demand. In addition, this new cutthroat era of veterinary medicine has led to longer work hours and higher levels of stress, and many seasoned veterinarians are leaving the field early or cutting back to part-time work due to burnout. Limited supply leads to more demand, and as veterinarians become even more in demand than ever before, corporations are offering enticing sign-on bonuses, high production pay, and very competitive salaries to doctors in order to cover shifts and keep hospital doors open. And thus a vicious cycle begins, and hospitals raise their prices even more. But what about the technicians and assistants, those invaluable staff members that keep the wheels of the hospital turning? Unfortunately, while costs go up, compensation for veterinary staff is often not reflected in these increased profits. Many veterinary technicians report feeling underappreciated, overworked, underpaid, while ironically remain the brunt of clients' frustrations pertaining to increased cost of care. Those who work in the veterinary field are in general highly empathic individuals who care deeply for their patients, and as more clients take their frustrations out on staff members who are already feeling undervalued, more pets get turned away because of finances, and economic euthanasias become more commonplace. The stress takes its toll, and the result is an even more limited supply of qualified, caring, invested veterinarians and staff. To summarize, the cost of veterinary medicine has gone up in the past few years for many reasons. High-quality specialty care is more widely accessible, owners are willing to invest more money in their sick pets, popular designer breeds are requiring more medical care, the number of qualified veterinarians and veterinary staff is limited, and a low-risk, high-reward scenario has caught the attention of some major corporations with lots of buying power, further fueling the capitalist machine. As we digest all of this, it's important to ask one simple question. Is it ethical for a pet to only receive care in the realm of what its owner can afford? The more I learned as I researched this topic, the more disillusioned I became with the future of veterinary medicine. Are we perhaps looking at a time when the quality of medicine is excellent, pet owners are more invested than ever, yet only a few elite pets can get the care they need? Some say that having a pet is a privilege, but to what extent? Is a homeless man who shares his tent with an abandoned puppy not entitled to that friendship? Does a sick child from a low-income family not deserve a companion to help him through his hospital visits? Should a family who lost everything due to unforeseen circumstances be forced to euthanize their sick pet because they can't afford the bill? I believe that we can and we must do better. Stay tuned for the next episode of Vetted, where you'll hear from Tammy, a pet owner and widowed mother of a disabled child who is struggling to cover the cost of her dog's medical treatment. And you'll learn what an organization called Free Animal Doctor is doing to help people like Tammy provide their pets with the care they need when they need it. I hope you've enjoyed this episode. Drop a comment below and let us know what you think. And don't forget to like and subscribe to the Aluna One Health YouTube channel for more content related to the health of you, your pets, and the planet. I'm Dr. Schumacher, and I'll see you next time.